Good morning, everyone. During this morning's briefing, we will have our regular update on COVID-19 in the province. Dr. Morrison will update us on the situation around the childcare facility in Charlottetown that we talked about last week. Marion Dowling will be able to answer some questions on the vaccine rollout and other issues pertaining to health P.E.I, as well as the progress to date, next steps with our vaccinations, and as well, we will discuss what the next few weeks and months will look like in P.E.I as we roll into late spring and into summer. So with that, I will turn it over to Dr. Morrison for her regular update. And over to you.
Good morning, and maybe close to good afternoon at this point. And I know it was beautiful out this morning here in P.E.I. There are 2 new cases of COVID to report in P.E.I today. Both of these cases are related to travel outside of Atlantic Canada. One is an individual in their 20s and one is in their 40s. These individuals did not travel together, so are not related to each other. Both are self-isolating and contact tracing is underway. There is a flight notification associated. Anyone who traveled to Charlottetown on Air Canada Flight 8012 from Montreal on Saturday, May 15th, should monitor themselves closely for symptoms and be tested if they develop any symptoms of COVID-19. We currently have 10 active cases and 194 cases since the pandemic began. In terms of an update with the Childcare Center from last week, a total of 3 cases associated with the daycare, all adults who are now in isolation. We have a total of 84 other contacts who are in isolation, and the first tests on all of these individuals have been negative, and they are due for their second tests yesterday and today. Overall in Canada, cases are down in the last week with an average of 6,464 cases per day. The variants of concern continue to surge in Canada. 94% of them are B.1.1.7. In P.E.I, we've had 19 cases of B.1.1.7, first identified in the UK, and 2 cases of the B.1.617, first identified in India. We are assuming that all new cases of COVID-19 in P.E.I are variant strains. The variants of concern appear to make the virus more contagious and result in more severe disease, increased hospitalizations and ICU admissions. There is growing evidence that some variants have had an impact on the efficacy of some vaccines, but we are learning more. Our understanding of the public health implications of these new variants continues to evolve, and more research is underway in Canada and around the world. In Atlantic Canada, there are 1,659 active cases. And as a note, when the Atlantic bubble opened last July, there were 5 active cases in the region. In the past 2 weeks, there have been over 2,200 new cases, and we have been reminded again how quickly COVID-19 can gain a foothold. Our colleagues in Nova Scotia are working tirelessly to contain the surge of COVID-19 cases in their province, reporting 793 cases in the last week. They are having a tough month, dealing with a spike in COVID-19 hospital admissions, over 90 people in hospital yesterday, including approximately 21 in intensive care, and that was higher than they expected. The situation in Nova Scotia is an example of what can happen, and happen quickly. It's important we remain vigilant and take steps to keep the virus out of P.E.I and limit the spread. We have reported cases in P.E.I for the past 14 consecutive weeks. Our COVID-19 activity remains steady with an average of 5 new cases per week for the past 10 weeks. 73% of these cases are related to travel outside the province, and the remaining 27% are close contacts of the travel-related cases. We are especially vulnerable to the importation of COVID-19. 2 weeks ago, we asked island residents who must travel outside P.E.I to register their self-isolation plans before returning to the province, and any visitors, of course, to P.E.I have to submit an isolation plan as part of pre-approval travel. Self-isolation is key, in helping limit the transmission of the virus, and this registration process ensures that self-isolation plans meet the requirements and minimize the risk of transmission of COVID-19. And I know I've said it before, the virus moves when people move. And no one thinks that they have COVID, and no one thinks that they will spread it. And certainly the virus has less opportunities to spread when there is less movement of people. Immunization is the best protection against COVID-19. We continue to make excellent progress with our vaccine rollout. The focus of our vaccine program continues to be to protect as many people as possible, as quickly as possible. Our primary goal is for 80% of island residents to receive 2 doses of vaccine by the fall, and for those who are in high-risk groups to be fully vaccinated with 2 doses as quickly as possible. I have been asked about how P.E.I. compares to other jurisdictions in terms of vaccine administration. Nationally, P.E.I. is similar to the per capita rate of vaccines given and has the highest rate of second doses administered when compared to other Atlantic provinces. Given we have administered more second doses per capita than most other provinces, our first dose coverage is a little bit less. Back in December, when we received the first shipments of vaccine, we felt it was important to give adults in high-risk areas 2 doses of the vaccine as quickly and safely as possible. We opted not to extend the interval for the second dose for high-risk populations, including seniors over the age of 80, long-term care residents and staff, frontline healthcare workers, and individuals in congregate living. In P.E.I., these individuals are fully vaccinated with 2 doses. As of Saturday, May 15th, 73,978 doses of vaccine have been administered, including 11,765 second doses. 44.2% of island residents over the age of 12 have received at least 1 dose of the vaccine, and 8.4% of island residents have received 2 doses of vaccine. We are aiming to immunize at least 112,000 island residents with 2 doses of vaccine, which represents 80% of the population aged 12 and over. And really, all island residents 12 and over can now book vaccine appointments at one of the public immunization clinics. Now it is your turn to get immunized, so please do your part and book your appointment. The supply of vaccine remains steady, and islanders are stepping up to be immunized. Again, we will offer first dose of vaccine to at least 80% of all eligible residents over the age of 12 by the end of June. We are expecting to receive over 80,000 doses of mRNA vaccine in June, 93,000 doses in July, and 77,000 doses in August. Based on these forecasts, the interval between the first and second doses will be able to be decreased. Second doses will be administered to those 12 years of age and older by September. It is important that everyone receive 2 doses of the vaccine to ensure they have the sustained protection from COVID-19. Recently, Health Canada approved the Pfizer vaccine for youth aged 12 to 15. This is very good news, and Public Health will be vaccinating this age group with their first dose in June. Since the change in the Pfizer age indication, public health nursing staff have been working on plans to administer vaccine to junior high students, grades 7 to 9, and are working with the education system to coordinate consent forms and schedule school visits. This week, 3,900 doses of Moderna vaccine will be distributed to 12 community pharmacies. And if you are over age 40 and over and have not yet booked your first dose vaccine appointment, you can contact one of the participating pharmacies to get immunized at a pharmacy this week. Please note, pharmacies are not administering second doses at this time. As we've mentioned before, the demand for AstraZeneca at our partner pharmacies decreased, and on Tuesday, May 11th, pharmacies and P.E.I. were advised to stop administering the AstraZeneca vaccine and replace any appointments with the Moderna product. Pharmacies are keeping enough AstraZeneca on hand for anyone who is unable to receive an mRNA vaccine, and that would include an anaphylactic reaction to one of the ingredients in the mRNA vaccine. A total number of doses of AstraZeneca given in this province is 5,228. Those who have received a first dose of AstraZeneca will not need a second dose for 12 to 16 weeks. We are following the results of clinical trials regarding the interchangeability of vaccines. They are being referred to as the mix and match studies. The results of this research will provide evidence regarding the best options for second doses. Some of the early results of these studies suggest there may even be an increased immune response when vaccines are mixed and matched. And we anticipate a national recommendation on second doses in the very near future. Many jurisdictions have paused the use of AstraZeneca for first doses due to supply issues and an increase in the rare and serious blood clotting condition, vaccine-induced thrombotic thrombocytopenia, or VIT, linked to this vaccine. P.E.I. has not had any reported cases of VIT. As part of a national vaccine surveillance system, our office collects reports of adverse events after vaccine and reports this information to the Public Health Agency of Canada. Individuals who got AstraZeneca received an effective vaccine, decreasing their chance of moderate to severe illness, and they did the right thing in receiving the first vaccine that was offered to them. Islanders have responded so well to the opportunity to be immunized against COVID-19. Thank you to all residents who've already been vaccinated or have appointments. Our enforcement partners have provided excellent support to the provincial pandemic response. Justice and Public Safety have completed 820 residence checks, 10 business checks, issued 205 warnings and 172 charges, and 8 pending related to individuals primarily for reasons of not self-isolating. Police were advised of a number of events over the weekend that appeared to exceed the current gathering limits. These events occurred across the province and were organized by or for teenagers, and in some cases, parents dropped their children off at these parties. Most youth attending these events dispersed before the police arrived. I encourage parents to talk with your children about the dangers of exceeding the gathering limits. Please make sure that you are not placing your child or others in danger by enabling family members to disregard the gathering limits and other COVID-19 restrictions. And speaking of youth, we've received a number of operational plans for graduation proms. A number of prom plans have already been approved. It is important that operational plans for proms follow the public health measures. Approval will not be granted for any prom for after parties or field parties. Like other provinces, we are working on a reopening plan. We are having discussions regarding potential plans for the summer of 2021 in terms of pre-approval, pre-travel approval, travel streams, self-isolation, gathering limits, and public health measures, and expect to be able to share details publicly in the next week or so. Our decisions regarding the upcoming summer will be based on a number of factors: vaccine uptake in P.E.I., COVID-19 disease trends in Atlantic Canada and nationally, our healthcare system and public health capacity, and the status and impacts of variants of concern. Of course, detailed planning looking forward in the midst of an evolving third wave of a global pandemic is challenging and difficult to have that crystal ball in place. Last week was Nurses Week, a special time for island nurses. Given we did not have our regular briefing, I wanted to belatedly acknowledge the tremendous work of nurses across P.E.I. The theme of Nurses Week this year was very appropriate. We answer the call. Indeed, nurses are stepping up to answer the call to manage COVID-19. Nurses are integral to all aspects of our provincial pandemic response. While nurses personify caring and service towards others, they have many other professional attributes. They are leaders, advocates, teachers, navigators, collaborators, team players, to name a few. Thank you to all the nurses who continue to work hard every day, going above and beyond the call of duty to help keep Islanders safe during this global pandemic. Each week we report on cases, hospitalizations, and deaths. While we report on numbers and data, these are not just cases. They are people, families, and loved ones associated with each number. As we make our own decisions about being vaccinated and protecting ourselves from COVID-19, let us think about the millions of Canadians whose lives have been changed forever as a result of COVID-19. If you have not yet made your appointment to be vaccinated, please do so. Do it for yourself and for others. And if you've already received one dose of vaccine, when it is your turn, please step up and get your second dose. Let us get vaccinated so we can do some of the things we long to do again: traveling, family reunions, celebrations, weddings, concerts, household gatherings, and sporting events, to name a few. As we continue to care and support each other through this global pandemic, let us continue to be patient and continue to be kind. Thank you.
Well, thank you, Dr. Morrison. And just before we go to some questions, I would make a statement as well. We talked about off the top about looking at the next few weeks and months as we roll into late spring and summer. You know, with respect to that, quite obviously, the mental well-being of families being reunited has been at the top of our list of priorities. We know that the past 15 months or so have been very, very difficult, and that far too many of us have not seen our loved ones, and we need to address that. We had hoped that the Atlantic bubble would have been open by now, and that would have allowed for us to have seen some significant family reunification. But as Dr. Morrison has indicated, and as most islanders know, that outbreaks in other areas within the region have caused delays. The Atlantic bubble will open as soon as it is safe to do so, and I am hopeful that that will happen prior to Canada Day, although as of today we have no firm date with the reopening of the Atlantic bubble. But we know as more and more islanders and Canadians are being vaccinated, that we can now cast our gaze to the future and to look at how we can allow for us to reconnect with our families and to take some of the steps necessary to safely bring back those to our province. And building on what we have learned from last year, we feel comfortable from a health perspective to begin processing family connections and reunifications, as well as Canadian seasonal residents of P.E.I. for entry to the province beginning on June the 8th. Like last year, we will have a staggered entry into the province up to a maximum of 500 households per week. Like last year, everyone coming to the province will require pre-approved travel and a 14-day self-isolation plan. New this year, there will be added health and safety precautions. Individuals will need proof of a negative test within 72 hours before entering the province, and they will be tested upon arrival at all points of entry for a COVID test. Whether or not you are vaccinated with either 1 or 2 doses, at this time, these protocols will apply. We will continue with our Operation Isolation, where individuals will be followed throughout their quarantine to ensure that individuals have the proper supports and that they are adhering to the public health protocols. But in addition, and new this year, our enforcement teams will conduct random isolation checks to ensure the highest level of compliance possible. As we monitor the science and the epidemiology, we are hopeful that some of these protocols will be adjusted and will change as the summer progresses. But as of June 8th and until further notice, enhanced travel and entry protocols will apply and will be strictly enforced. Now, these delays in our entry streams into the province, as I said, while frustrating for some, have allowed us to protect more and more islanders. And that brings with it our ability and comfort to expand and change our risk acceptance. And by the week of June 8th, over 90,000 islanders will have at least 1 dose of vaccine. So these are careful steps forward, but they are forward steps. They are cautious, and they are made using the information that we have learned, what we have practiced in the past, and they are rooted in our past successful experiences. And as we make our way through, we will need to be careful, and we will continue to be careful. But we also will need to continue to make more and more cautious and careful steps, and as part of our way back to normal. We will do that using the best science and epidemiology, as Dr. Morrison has outlined. But we know that we are on our way back, and we will do it carefully and cautiously as we have done throughout. But it's important that we begin to look toward the late spring and summer. So with that, I will open up the floor to questions from our friends in the media, and also remind them that Marion Dowling is here also to talk about vaccination clinics and other issues pertaining to health, P.E.I. and health delivery here. So with that, I will turn it over to our friends in the media.
Steve Bruce, CBC.
Yes, good day to you all. I know the P.E.I. Pharmacists Association said yesterday that there are 1,500 AstraZeneca doses that were sent back to the provincial pharmacy now. So can you talk about what happens with those doses now?
Hi, Steve. So we do have some AstraZeneca in the provincial pharmacy. I've actually asked Dr. Tam for some direction in case that AstraZeneca could be used elsewhere. At this point in time, really, the country is not using AstraZeneca for first doses, but even wondering if that AstraZeneca can be used by either in some place, whether or not in the country or outside. So we're just waiting to hear.
And to be clear, I guess, is there still a chance here on P.E.I. that AstraZeneca will be used for the second dose? And I guess what will be your message to those that got AstraZeneca with their first dose and they're worried now about what lays ahead with the second one, when at this stage there's not a lot of clear science on the safety of getting AstraZeneca for the second dose, or the safety of mixing? If they're worried, what would you say to them?
Well, I mean, I can understand that concern, and at this point in time, that's why it's important that we wait for the best advice coming and the best direction that we get nationally, and if there's an mRNA vaccine that's recommended for second dose, we'll have that available. If there's a AstraZeneca that's recommended as a second dose, we'll have that available, and we'll be able to make sure that anyone who's receiving a vaccine has the best information to consent to the vaccine at that time. So, what will happen, Steve, is as soon as that decision is made or that direction is provided to us, it will be relayed, and the immunizer will be in touch with the person who received the first dose of vaccine, and they will be given direction about coming in for their second dose.
Okay, thanks so much.
You're welcome.
Thank you.
Brittany Spencer, ABC. Good afternoon. I was hoping to get a little more clarity on vaccines for those who are 12 years old and up. You mentioned that they can now book, and the goal is to have first doses administered in June. I know last week there was talk of public health going into schools and administering vaccines there. I'm just looking for some clarity about how this rollout is going to work for this age group.
Hi, Brittany. So I think I maybe I didn't make it clear enough, but I'll start and we'll go that. So public health nursing is planning to go into the schools with grades 7, 8, and 9 in June, and they're working with the school systems, and they're used to doing school-based programs. They go in and do meningitis vaccine and Tdap vaccine already in schools. In grade 9, they do grade 6 school-based programs, so they're really good at doing school-based programs, and they're used to working with the school systems and the schools. So that is the plan for those in that age group in grade 7, 8, and 9. Maybe you want to add to that?
Yeah, I mean, that's essentially what will happen, Brittany. And the other piece is that anyone age 12 and above now is able to also go online and book in our online booking system or using the phone line. As of today, they can call and book because we know there are some youth in that age category who may be homeschooled and may not be in our public school system. So they are eligible to go online and book in one of our community clinics and welcome to do that as of today as well.
Okay, great. Thank you so much. And my second question is to follow up on some of the things you mentioned about enforcement, but specifically to follow up on the investigation into the cases at the daycare center in Charlottetown. I was wondering, I guess, what the status of that investigation was and if any charges or fines have been laid at this point.
So, Brittany, their information related to two of the individuals have been relayed to the enforcement, and that information has been sent to them. So at this point, that is all I'm aware of, and so I can't speak to what charges or how many they have proceeded with.
Okay, thank you very much.
Thank you.
Dave Stewart, The Guardian.
Good afternoon to you all. Dr. Morrison, you've said in the past that we're one bad decision away from things turning on a dime, and we've got the May long weekend coming up soon. The weather is warm. We've got proms coming up. People, as the Premier said, have been separated from their families for quite some time, and it's taking a mental toll. And this just comes on top of an RCMP news release warning people against gathering. Just wondering what your biggest concern is as we, close in on getting everybody their first dose.
I think my biggest concern is the same that I've had for the last 14, 15 months, trying to make sure that we get through this pandemic as safely as possible. I don't want anyone on P.E.I. to die of COVID. I don't want a big, huge outbreak to happen. And those have been the same things I've been concerned about, and I know the whole province is feeling the same. So I feel like if we can just hold on a little bit longer, and when we get more people vaccinated, it will reduce the chances of if we have an outbreak, that the impact in terms of hospitalizations and bad outcomes won't be as significant. So if we can certainly continue to try to protect people and do all the things we're doing, and I think we've done them, pretty well for the last year in terms of trying to minimize importation of the virus when we've recognized it here, minimize transmission, and I think we need to just continue to do that a little bit longer until we get the disease rates down in the region and in the country and protect more islanders.
And Dave, if I could just add to that, because I think a big part of this is also, the mindset that we have as islanders. As we see relaxing into the future, we still need to adhere to some of the protocols that we have been following for a while. We still need everybody to be careful. There's no miracle here that this is just going to disappear. So we're still going to need people to practice safety and precaution and to do things a little bit differently than they had done in the past. So that this isn't a sort of an all or none, wait to such a date and then we don't have to do anything. Like, we're going to need continued public health protocol adherence and vigilance for all islanders. So if you're able to gather in bigger groups somewhere along the way, we're still going to need you to be careful, to mask, to use our sanitizer, to do all of the things that we've been doing for the last 15 months, because it's this is with us well into the future. So we can't just stop everything that we have been doing, even if we're able to relax a little bit down the road. So just important for islanders to keep that in the top of their mind.
Thank you both for that. I guess my follow-up question would be, Dr. Morrison covered a lot of this ground, I think, but I have noticed a couple of national media reports and Statistics Canada put out numbers last week showing the P.E.I. is last in vaccines administered. Now, I think their numbers are based on overall population, not eligible vaccines. So I guess, Dr. Morrison, are we doing better in terms of eligible? Are you happy with how we're doing with eligible Islanders?
I think it's a couple of things. One, I am really pleased. We've said right along, we need to do this steady march. We know what the end goal is to try to get 80% of Islanders with the 2 doses in order to protect us all and our community. And we are doing that. And as we get vaccine, we're getting it into people's arms. And Health P.E.I, pharmacy partners are all helping in that march. And I think that some of the challenges when you see some of the other numbers coming in, that sometimes they're using numbers that are a week old, and with our population, not including a few thousand doses makes a big difference in some of the percentage of what they use. And so I'm very comfortable with the numbers that we talked about today, that 44.2% of Island residents 12 years of age and older have received at least 1 dose of vaccine. And then we look at 8.4% of Island residents have received 2. We know we have a way to go, but we are getting there. And it wasn't that long ago that we were talking about, 10% of Islanders having received the vaccine. So we are getting there in terms of the numbers, and we just have to keep going. I think this week coming, we'll have the highest amount of vaccine delivered to the province that we've had to date. We have over 12,000 doses arriving in the province of Pfizer and Moderna combined. So it's a big week for vaccine arrival.
Dave, can I just cut in there, Dave? I just want to say, I've been asked this a lot too, and I think 2 things that I would stress is that as quickly as vaccines are coming into P.E.I, we're getting them into the arms of Islanders. It's a per capita across the board. Everybody is getting essentially the same amount. And the race here is not against another province. The race is against the variants. It's against the COVID itself. We're all going to end up by the end of June in essentially the same place, and we're on track to do that. So I think we got to remember who we're in the race here against. The race is against the variants and against COVID.
Great, thank you. And I was just going to ask roughly on a daily basis how many Islanders are getting vaccinated. That's been asked in the past.
Yes, and I think we've talked about over 1,000, so I think it's around 1,500 a day at this point in time. And I'll just to pick up on your last question too, it's important that all Islanders get vaccinated, but it's also important that all Canadians are getting vaccinated, because it impacts the level of disease in this country, or it will impact the level of disease and protect everybody. Sorry, I'll see if you want to add.
Yeah, no, I think that it's all been said, but really we're just doing it as quickly as the doses come to us, and we're only one part of it now. We're happy to have the community pharmacies participating as well, but we do have the capacity to add more if more doses are here, and that's what we continue to do with the sometimes precarious supply and dates and times. But I would agree with Dr. Morrison. It's going very well. We have had a few bumps in the road, but our planning has been agile to adjust to the supply shipments and dates. And we have just continued that march forward, and people are coming out to receive the vaccine, which is also a very important part of this whole rollout.
Thank you all so much.
Thank you.
Thanks, Dave.
Maude Montembeau, Radio-Canada.
Oui, bonjour. La question est pour Dr. Morrison. J'aimerais, Dr. Morrison, que vous nous disiez d'un point de vue de santé publique, quels sont les critères manquants pour la réouverture de la bulle atlantique et la réouverture des frontières avec le reste du pays.
Okay, bonjour, Maud. Je vais... peut-être j'ai mentionné en anglais, je ne sais pas, mais on a c'est pas seulement le nombre de cas. On a les épidémiologistes de la région atlantique fait les rencontres chaque semaine et puis ils discutent toutes les choses qu'on veut regarder vraiment à propos de l'ouverture, ce qu'on veut en place avant l'ouverture de la boule atlantique. Et puis, je cherche mes notes en anglais, mais c'est vraiment le nombre de cas, c'est le nombre de... qu'est-ce qui arrive au pays, pas seulement dans la région, parce que ça a un impact sur nous autres. S'il y a des outbreaks qui sont là, c'est quoi le nombre de personnes à l'hôpital, est-ce qu'on a la capacité de santé publique. Alors, c'est vraiment les choses, ils parlent de ça aux régions nationales, mais on regarde ça aussi chaque semaine. On fait ça ici à l'île du Prince-Édouard et je sais dans la région aussi. Et puis, maintenant, on regarde aussi le pourcentage de personnes qui sont vaccinées avec leur première dose, deuxième dose. Et c'est une autre chose qu'on regarde avant. Vraiment, ça c'est l'ouverture, pas seulement pour la boule atlantique, mais pour voyager au Canada, vraiment.
Et dites-moi, pour les familles qui veulent se retrouver pour l'industrie touristique qui se pose des questions à l'heure actuelle, pouvez-vous leur dire concrètement, là, avec le portrait qu'on a, qu'est-ce qu'il manque pour que ça puisse ouvrir la bulle atlantique et ça puisse ouvrir avec le reste du Canada? Qu'est-ce qu'il va falloir qu'il arrive?
Vraiment, c'est vraiment un peu la même réponse que je viens de donner. On veut, mais à ce moment, les familles, les personnes qui sont reliées comme famille à l'île du Prince-Édouard peuvent faire une application pour voyager à l'île du Prince-Édouard. Il doit avoir un test avant d'entrer et puis il doit tester quand ils sont ici. Il doit avoir un plan pour isoler pendant 14 jours. Il doit isoler pendant les 14 jours, on va faire les appels. Alors, ça arrive maintenant si c'est pour les raisons pour compassion, hein, mais ça va aussi arriver après le 8 juin, le 8 juin pour d'autres connexions de famille. Et puis, pour ouvrir à part de ça, c'est pour la boule atlantique, c'est vraiment toutes les choses que je viens de mentionner, qu'on veut avoir moins de COVID-19 dans la région, moins de COVID-19 et vraiment au pays. Et on veut que de plus en plus les personnes sont vaccinées.
Est-ce que c'est juste la situation en Nouvelle-Écosse qui fait qu'à l'heure actuelle, on ne peut pas rouvrir la bulle atlantique?
Non, c'est pas... certainement, il y a plus de cas en Nouvelle-Écosse, mais même au Nouveau-Brunswick, ils s'inquiètent un peu les variants et on a encore plus de 50 cas à Terre-Neuve dans la semaine qui passe. Alors, ça c'est pour... on discute avec mes collègues. On vient de discuter hier soir. Et puis les épidémiologistes de la région, ils discutent aussi. Et puis, ils font vraiment un report chaque semaine pour en regarder.
Gabrielle Drummond, Radio-Canada.
Good afternoon to you all. Ma question, c'est en français pour la docteure Morrison. Alors, Dr. Morrison, je voulais parler du vaccin d'AstraZeneca. Alors, vous venez d'annoncer que l'administration de ce vaccin est suspendue depuis la semaine dernière dans les pharmacies. Vous l'avez répondu en anglais, mais j'aimerais l'entendre en français, s'il vous plaît. Pourquoi vous suspendez l'administration de ce vaccin et qu'est-ce que vous dites aux personnes qui ont déjà reçu une première dose pour les rassurer?
Bonjour. Alors, pour quelques raisons, on avait de moins en moins de personnes qui qui voulaient prendre le AstraZeneca aux pharmacies. C'était ici à l'île du Prince-Édouard seulement 55 et plus de l'âge qu'on avait fait. Alors, il y avait presque plus d'intérêt. Et puis, on a eu le Moderna et puis on a donné Moderna aux pharmacies. Alors, ils pouvaient vraiment remplacer AstraZeneca avec Moderna. Et on regarde aussi le nombre de cas de VIT qui s'arrivent. On n'a pas eu les cas ici à l'île du Prince-Édouard, mais il y a la plupart du pays ont décidé d'arrêter la première dose d'AstraZeneca à cause de ces réactions qui sont rares mais sévères. Alors, c'est pour ces deux raisons. Et puis, pour les 5000 personnes à peu près qui ont eu AstraZeneca ici à l'île du Prince-Édouard, on attend la direction nationale. Et puis, qu'on a ça, on va les contacter pour dire vraiment quel vaccin ils devraient prendre comme deuxième dose.
Ma deuxième question, c'est par rapport justement à cette deuxième dose. Donc, si on décide de mélanger deux types de vaccins différents, d'AstraZeneca et avec un autre, par exemple comme Pfizer, qu'est-ce que disent les études concernant l'efficacité de ce mélange-là et est-ce qu'il y a des effets secondaires si on essaye de mélanger ces vaccins-là?
Ils sont vraiment, ça c'est qu'est-ce qu'ils regardent aux régions nationales, et puis il y a des indications vraiment de la Grande-Bretagne, des études là-bas qui disent que c'est peut-être une bonne chose d'échanger, mais c'est toute l'évidence qu'ils vont regarder au niveau national et puis nous donner direction. Alors, on attend l'évidence vraiment nationale pour faire une décision.
OK, parfait. Merci beaucoup. Bonne journée.
OK, bonne journée.
Okay, well, I think that brings to an end our news conference today, so thank you to both of you for your hard work as always, and to all Islanders, stay safe.